What did they do to her? This was from a TikTok account from either a med spa or a doctor from another country, and they said that this was all done with filler and threads. Some people are claiming that this is actually due to a filter. Is it filter or threads or filler? Honestly, I have no idea. But why did they do that to her? She apparently has the world's largest rear end, and she underwent many surgeries to basically inject fat into her butt to make it so huge. What a lot of people don't realize is that BBL surgery, the Brazilian butt lift, that is when you inject fat into the buttocks, has the highest mortality rate in all of plastic surgery if it's done in the wrong hands. And it really comes down to the technique. If the fat is injected into the subcutaneous tissues of the butt, that's the fat below the skin and above the muscle, it can be a very safe operation. But if that fat is accidentally or purposefully injected into the muscle of the buttocks, and the muscles are quite large, that fat can become a fat embolism and you can die within minutes. So if you're thinking about a BBL surgery, do your homework, make sure you have it done by a board-certified plastic surgeon with a ton of experience. Ideally, they also want to be using ultrasound guidance where they can see exactly where that fat that they're grafting is going into, because if that gets into your blood vessels, you are in big, big trouble.
My name is Mahogany and I have lymphedema in one leg. I want to be the girl with a big leg that can dress. I love wearing dresses. Trust me, they all show my legs. I used to feel like I was cursed. As I got older, I just finally learned not to give a and I finally built my confidence.
What a breath of fresh air she is. The fact that she has such confidence, she feels great. I really, really like her. Now she has lymphedema, and this is where the lymph channels in your legs or another part of your body can actually get clogged up, causing a buildup of fluid in that body part. Now, most of the time, you are not born with lymphedema. When you have lymphedema, like in her situation, it may be congenital, where she may have had some abnormal growth or development of her lymph channels, causing that buildup of fluid. But most of the time when somebody gets lymphedema, it's caused by an outside source. In third world countries, this can be caused by worms that actually will clog up your lymph channels. Yes, worms. Here in the United States, it's more commonly caused by treatments such as surgery or cancer treatments that can affect those lymph channels. That guy's got like a 10-pack. Is this real? Well, for him to drop his body fat percentage down to the point where you can literally see all of his 10-pack, I mean, I guess it's possible, but that's a huge feat. The other question here is, has he had surgery? There is an operation called high definition liposuction, where you can liposuction along the ridges of the abdominal musculature. We call those ridges tendinous inscriptions, and you can basically cause the fat that is left over to look kind of like muscle. And in some cases, the results look really, really good. Take a peek at this result from a good friend of mine, Dr. Charles Galanis. But the fact is that when you have abdominal etching or high definition liposuction, it isn't muscle that you're seeing here. It is actually shaped fat. This guy, it does look like muscle, so it's a tough call. That's impressive.
Бачиш, що так от ти спитаєш у когось, типу, поняла? От, чому нема відносин люди, чому вона нема відносин, якась не така.
Wow, did you see her cheeks? Now she claims that this is all due to injections of filler, hyaluronic acid filler, but they look so solid. I mean, they do look like they're actually made of bone or some other type of more solid filler. Now, I have seen some photos of her where the cheeks look fairly red, and that can get really concerning. When you're adding so much filler into parts of your face, it can actually cause pressure on the tissues, and if there's enough pressure, there may not be enough blood supply, and that tissue can literally die. So it seems like she's got just a ton of filler in her face. You can actually inject an antidote to melt it away if it truly is all filler, but I do wonder if this isn't just filler, but if there may be some type of implants involved as well.
Guys, I don't know what just happened, but something clearly happened. And like, I never know when to actually go to the hospital or not. Like, I feel completely fine. I can't see properly.
How is she so calm when her eyes have blown out like this? She appears to have a severe allergic reaction. And if you are this puffy, you have to go to the hospital. The worry that we have with this type of an aggressive allergic reaction is that you can get swelling around your throat and it can literally cause your throat to close up. So the first thing that she needs to do is get off of TikTok and go to the hospital and get treated right away. If she doesn't have access to a hospital right away and she has an EpiPen on her, then I would definitely use that in the meantime. This is a solid silicone nasal implant, and some people call it an L strut because it literally provides the shape of an L from the side. Now, this kind of implant is not commonly used in the United States unless you're undergoing some type of ethnic rhinoplasty. If you're African American, if you're Asian, sometimes if you're Latinx, then sometimes these types of rhinoplasties are performed differently than if you're, let's say, Caucasian. The problem with an implant like this is that it puts pressure on the tip of your nose. And this type of implant is very well known to have a high risk of problems of healing of the tip of the nose, because pressure on the tip of the nose for year after year after year can cause blood supply problems. And like I mentioned earlier in this video, if you don't have enough blood supply, things die. And these types of implants have even been known to extrude and come out of the nose. That, not surprisingly, would be a disaster.
This is to anyone thinking of getting freckles tattooed on their face. Don't.
Great advice. If you want to try freckles, then I would encourage you, try like henna or the tattoos that my kids use where you put it on your skin and then you put like a wet washcloth over it. See if you like that first. You can actually get those on Amazon now. And if you like those so much that you want to tattoo your face with freckles, then that's on you. But keep in mind, as a plastic surgeon, what exactly are freckles? Freckles in general are signs of sun damage. Do you want to tattoo signs of sun damage on your skin?
这边是来自浙江的姐姐啊，今年55岁，做的一个全脸拉皮。
What the hell's going on there? I tell you, the plastic surgeons in Asia are just going nuts. The amount of surgery and aggressive surgery that they're performing on these poor Asian women, I mean, I know that they sign up for it and all of that, but the society and the culture, especially where my whole family is from, South Korea, is so plastic surgery obsessed that it's just not right. And the fact is that you're not seeing tons of guys having all this work done. It's typically all women. And it's become a situation, unfortunately, where I do believe some women feel that they have to have plastic surgery to feel beautiful. And that makes me so, so sad. Wow, that's impressive. So what's going on here? Well, most likely she has breast implants that are under the muscle of her chest. We can put breast implants above the muscle or under the chest muscle called the pectoralis muscle. And when the implants are placed underneath the muscle, if you flex those muscles, it can cause the implants to move in different directions. That's one way I can tell when I examine a patient whether their implants are above or under the muscle. So I have them put their hands on their hips and press towards their belly button, and if they do that and the implants start moving, then I know most likely they're under the muscle. Now, every time I do a TikTok reaction, I like to end off with one of my videos. Take a peek at this TikTok video and we'll chat about it afterwards. Desiree.
Yeah?
You do Dr. Subio, Jenny's gonna do me.
Do Dr. Subio?
Oh, just go help him in the OR, please.
Are you heading out?
Yeah, I'm gonna go pimp the medical students.
Pimp?
Yeah, I'm gonna go quiz them on what they know. Desiree,
Yeah?
can you push my stool in?
Push your stool in? What?
Just push my stool in so I don't fall. What's wrong with you? There are so many things that we say in the operating room and really in the whole medical field that if we stop and think about it, it really sounds kind of dirty like what you just saw. These are all things that we say all the time in the medical field and we don't think twice. But where I do think twice is when you look at extreme plastic surgery that has gone completely haywire and wrong. Take a peek at this video where I react to some of the worst extreme plastic surgery TikToks. These will blow your mind. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.